Xin chào, I'm Dr. Chris. I'd like to briefly go on today about the stem cell. From yesterday and today, very much the interest and your fever about the regenerative medicine is very high, I think. Today, I just want to say, among many things, as our previous doctor has mentioned, also this will be a very easy one that to install the stem cell thing to your clinic. Well, I'd like to mention as a disclaimer, I will show the result of our research at the end, but there was no financial or any other support from the kit machines. So, as you know, today, many exosomes, stem cell, inflammation, many things have been happening and been in the conversation. It's toward about the stem cell market. It's actually growing a lot by 10% every year. So I'm sure you're much interested in the Vietnam market as well. So the evolving area about the stem cell or the regenerative medicine, before it was about the reconstruction or the regenerative medicine, I think we're doing this toward regenerative aesthetics. So what is regenerative aesthetics? Well, with the stem cell therapy, actually, you could approach many diseases. If we refer to one very high-renowned institute, which is like this Harvard University Stem Cell Institute, if you see, many diseases are being researched by many renowned professors so far now. But that is one case by case, and actually toward to cure the diseases. What I'm trying to say today by the blood stem cell will be a little bit less than that, but it will be much easier to install and begin your stem cell treatment in your clinic. So what we're talking about the stem cell right now is not the embryo stem cell. We're only talking about an adult stem cell, which is exclusively it's okay with ethical issues. Adult stem cell, so-called mesenchymal stem cell, we can easily retract from three options. These are three, so adipose tissue, bone marrow, and peripheral blood. Mostly I preferred adipose tissue, but we are going to talk about peripheral blood thing at the end of today. The reason why the bone marrow is very well used also in Korea, in the next slide I will show you that it's been guaranteed by the government. It's actually worth to try procedure from the bone marrow stem cell to the knee for the arthritis. But the bone marrow I tend to not to try is, if you see the stem cell in our human body gets decreased by 50% by 10 years. So if anybody who's over 70 years old, if they come to our clinic, if we open bone marrow, usually it's about half empty. So it's not worth to try, rather than try adipose tissue or the blood, peripheral blood. So the adipose tissue research thing has been many researchers, many professors, many clinicians already have done a lot of effort. So it's already guaranteed clinic, guaranteed procedure to treat the arthritis. And also, I'm sorry, this is about the Korea now in Seoul. So which means now this is by the government guaranteed insurance, it's covered. Which means it's hard to get those insurance things in Korea if it's not worth or it's not proved to have effective. But this getting from the bone marrow to the knee joint is guaranteed procedure in Korea now. So if you see at the end here, it has been proved that this technology has similar level of pain relief and joint function improvement, proving its effectiveness already. But this is not a peripheral blood stem cell yet. So why I'd like to introduce our peripheral blood system, because everything, if something is good, it takes time. I do know, and we also know the bone marrow and the adipose tissue will be better than the peripheral blood because it contains more stem cell inside. But once again, it takes time to learn how to take a fat tissue. Last week, there was Indonesian workshop session about the adipose tissue tracking. People are learning to get adipose tissue fat grafting. But this will not just one time, it will take a lot of time actually to get it well. So to install the stem cell, very easiest one tomorrow in your clinic will be the best one is probably getting peripheral blood stem cell. So what's the thing is there are many companies other than NOVASTEM, so it's up to you to choose the right one for your clinic. I'm just introducing our thing about the peripheral blood stem cell. So why I recommend this one is because compared to bone marrow or the adipose tissue, this is just simply easy. You just draw the blood from it and using the centrifuge machine, and there will be SVF and the stem cell ready to treat. It's easy. I know, and you can say it will be comparably less powerful than adipose tissue or the bone marrow, but this is very beginning and initial way that we can treat patient with these things. With this, I would like to compare hematopoietic stem cell transplantation and this blood stem cell thing. When we're talking about stem cell, there's 5 things: stem cell, white blood cell, stromal cell-derived factor 1, growth factor, and platelet. These are 5 main factors that needs to be in there for the treatment of stem cell. So this is a little bit different what we are going to use. As a specialist in the laboratory medicine, when you have a leukemia, we do the radiotherapy, we kill the bone marrow, and then we transplant this hematopoietic stem cell to you. And when we do this, it takes a long time, about 3 or 4 days, to increase. We also inject the GCF to make the blood out of the more stem cell, and it takes longer time. So what we're doing is not a transplantation, but just simply taking out peripheral blood and doing the stem cell with a centrifuge system. But mostly with the transplantation, this is how you do in the university level hospital. So you take the blood and then we take only stem cell, we thaw it and dilution after chemo, and then you are putting the transplantation for the stem cell. So this is what happening in the transplantation when you have leukemia. But next one that I want to show the peripheral blood system is something very, very easier than that. So then how much stem cell do we need? When we regenerate a person after chemograph, this is the number that we are talking about. So probably 6 million stem cell per cell per kilogram is needed to regenerate your bone marrow. So that's the notion. And this is HeartiStem. This is very famous, already made treatment in Korea for the knee joint. And they are saying about 5 million points per in the vial to regenerate your arthritis. So what we're doing here is with the peripheral blood system thing, that it's simply taking your blood out and then concentrate, and it divides into red blood cell and white cell and the SVF as well in the very minimal stem thing. So this point is, it's not like increasing, or it's not making more out of your own blood. It's just simply concentrating it to make concentrated. So how it works? Probably you've been told like a PRP is already much more familiar your system, but PRP kit. So I always say this is a little bit different, or the upgraded version of the PRP. So there's a 2-chamber or 3 chambers lock dividing this red blood cell first, and then letting other PRP or the SVF in the middle of this area. So this contains about the stem cell at the top. In the middle is already known the PRP, so we can use both ways in our treatment. So once again, I would like to emphasize this is a simple way to begin the stem cell treatment in the clinic. I'm not here to aiming about the kit thing. I just want to introduce we've been doing the lab clinic research with 11 patients in our clinic. So that's the after centrifuge. That's what you get at the clinic. And like this, you can either do on the hair, or you can do the IV treatment as well. So it's just that simple in the treatment. So I'd like to just share about the case studies by just simply doing peripheral blood system using the NOVASTEM kit. We recruited 11 patients without any payment. We only had a consent that we are going to run such a test after and before the treatment and after the treatment. So it took 3 weeks, 11 patients. We did a telomere lengthen theorem. It's about the how well your antioxidant is breathing in your body, and also NK cell, hormone IGF, and such a minimum labs. We work with the CGen. It's one of the top 3 laboratory company for this. So what I'm trying to say is that this is authentic result that we are verifying in the about team. So I grouped about 20, 30, 40, so 2 people respectively with the age group, and then we got 120 blood, 120 cc blood. So that's the 4 chamber of the blood stem, and all the people, 11 people, were not known as disease, just normal person, normal daily life. And then IV injection we did as in the video that I just showed. And then there was a local demand for those 2 people who wanted in the backache and the headache. And then we run test, as I mentioned, before the treatment, and after 3 weeks we did this run labs once again. So this I can show. I get my references at the end of the presentation as well. But this is I can show because this is mine actually. So as you see, the telomere got longer. And all the labs, if you see closely, it's got better about the liver thing. And I actually had a little bit higher glucose tissue here, and then it's getting quite better. And third one, the NK activation is got higher, which means your immune system is getting better. And this is Rome. Well, I already had a good one to compare the good one, so it was fine. So generally, except me and people here, if I may introduce, out of 11 patients, the telomere length, one was same, but other 10 was all lengthened. And the general condition, they say, among the elderly people, those who could not sleep well, they said they had a good sleep after the treatment, and all 11 people said less fatigue, which means I believe that is linked with the liver function as well. And the ladies who got this as a brightened skin texture. And the one local injection to the back, for the backache, got less backache. And NK cell activation, unfortunately, there was a not like authorized up and down thing. So that people just not show the NK activation, but some people got lower. So I think this was not very linked with this stem cell treatment. And also this inflammation with the skin, atopy skin they got treated smooth skin in about a week, but they claim to be about 2 months later it's regained. So a unique thing, one lady did not tell me before the treatment, one set of vaginal bleeding was stopped after the 3 days. So this was a very interesting thing. It's actually affecting somehow with the minimum of the stem cell power that is actually helping the condition of the general condition of the body. But there are many co-linked diseases. This is about the multiple sclerosis fatigue. So with the hematopoietic stem cell, you get actually better in the fatigue. And also, this is about the pain thing and the hair loss. This is skin wound healing. And this is lastly the atopic dermatitis. So I'm not saying with the peripheral blood stem cell, this kit, as I showed in the disease curing, it's very far from the disease curing. But I think this will be very close to your clinic to initially start about the stem cell treatment. It's very easy to use, and it's worth to begin the treatment. So what is the key about this peripheral blood stem cell? I think it's easy to use and low learning curve, like bone marrow taking out or the adipose tissue taking out. About the 120cc, it's quite hard to take 120cc in your clinic. With even professional nurses, it's hard to get it at 120cc. But the point is, which kit will be more concentrating well to out of that 120cc to get that SDF or the stem cell out of all we have. So we're not asking for more because it's not a cultivating, it's not growing stem cell, but out of what we have, what we can do the best out of it would be the best treatment we can get to our patient. So this is my presentation today, and we are thinking to open this like a more academic research one. So if you're interested about the stem cell, that we could join and study in academy as well with the Demire as well. Thank you very much. This is my end of presentation. Thank you.